So, I often get asked about adult ADHD and how do I go about getting a diagnosis. So, I thought it'd be really useful to jump on and talk about how do you get a diagnosis, but also to write a blog about it, which you can find the link below to. So, in the UK, there's really two assessment pathways to get an adult ADHD diagnosis. And one is through the NHS. And that means you would contact your GP, speak to your GP about your challenges, and then get referred to specialist adult ADHD services. Now, the challenge with the NHS is one, it's very difficult to speak to your GP. Two, there's long wait lists. And three, many trusts and areas actually don't have specialist adult ADHD services. So the alternative pathway is the private assessment pathway, which I am here to talk to you about. And I'm going to discuss the Diverse Diagnostics pathway. So the private ADHD assessment pathway, firstly, does not require you a referral from your GP to get assessed by ourselves. So you can get in touch and book in for an appointment for an adult ADHD assessment via phone, email, or by booking in for a free 15-minute consultation. Now, that free 15-minute consultation is really useful because it gives you an opportunity to discuss your symptoms and challenges with a clinician and to see if our adult ADHD assessment pathway is right for you. It also gives you a chance and understanding about how we work as a clinic. Once we get that information from the free 15-minute consultation, you get booked in for your appointment with an adult consultant psychiatrist. It is important to note we are a consultant psychiatrist-led clinic, which means that all the consultants are GMC registered. We follow NICE and national guidance when it comes to the adult ADHD assessment pathway. It is a video appointment and it is 1 hour and 45 minutes. So prior to this appointment, we would ask you to fill out questionnaires, and it helps us give us an understanding about your mental health, but also about your ADHD symptoms. We would also ask you to nominate an observer, and an observer is someone that you know very well from your early days that helps us understand your symptoms and challenges and what your life experiences have been like. Once you go to speak to the adult consultant psychiatrist, that looks like a conversation and it feels like a conversation, and it is about understanding your life, your challenges, your symptoms, and how the symptoms have impacted your quality of life. We look at things as your early childhood years, we look at your previous mental health history, we look at your general mental health. All of these things are really important because it is noted by research that 60 to 70% of adults with ADHD also suffer from depression and anxiety. So it is important to have an expert in your mental health doing an adult ADHD assessment and not just looking at ADHD, but looking at your general mental well-being. At the end of your appointment, the consultant psychiatrist will generally be able to tell you whether you have a diagnosis of ADHD or not, and they'll be able to tell you verbally. But within 2 weeks, you will get a formal medical report which shows how you meet clinical criteria and what the recommendations and treatment options are for yourself. This report gets sent to yourself and to your GP. At Diverse Diagnostics, we offer an aftercare call as well with our aftercare coordinator. Now, what this person does is they talk to you about your report. They look at what the treatment and support options were recommended and help support you in taking those next steps. We understand that when you have ADHD, it is very difficult in terms of procrastination and in terms of making those and feeling motivated and making those next steps. So we want to support you every step of the way. So I hope you have found this helpful in terms of helping you understand how to get an adult ADHD diagnosis. Please feel free to leave a comment or message us.